People then ask, well, why do we get pain? Well, muscles take a lot of energy as well. And when muscles don't have enough energy, they get locked in the shortened position. And you'd think that it takes energy for muscles to contract. But think about it, writer's cramp, rigor mortis, tight as a board. When your muscles get exhausted, they go tight. They get locked in a shortened position and they hurt. So this chronic muscle pain will go ahead and be the initial trigger for pain. Anytime you have chronic pain, including chronic muscle pain, it then will trigger neuropathic pain, central sensitization, small fiber neuropathies, things like that. But as Robert was saying in his talk, you put a needle in a trigger point, it's going to release. 70% of trigger points correspond with acupuncture points. And if you go ahead and put a needle in either of those, they will release. One of the reasons fibromyalgia can respond very well to acupuncture.